everyone, I'm Denise Koh. I'm from Manitoba, Canada, and I want to talk about my pitch, which is the MedResRx Combined Burnout Blaster Boot Camp. So, first I want to talk about all the great things I've heard today from everyone, particularly related to Filipino women, and just how awesome we are in the workplace. So basically, the journey of Filipina care workers to wealthier nations is a tale that spans many decades, and so it's really driven by this socioeconomic factors, particularly a difference in them, and obviously the promise of a better life for the Filipino. So Filipinos are known for a number of things we've heard earlier today, nurturing qualities, their unsurpassed work ethic, and then as well their incredible social skills, and just having an accommodating demeanor. So essentially what that boils down to is the fact that we rock in the workplace. So we care and love almost to a fault, sometimes to a fault. We get even the hardest job done, and we smile when we're doing it. But there's something behind the smiles, right? So Filipino care workers face numerous challenges, such as long working hours, high emotional stress, underpayment, limited social supports and responsibilities to the families that they have usually back home. And so all of this, coupled with racial and gender-based discrimination, can lead to systemic injustices and obviously, well, potentially a high rate of burnout and turnover. So essentially, I wanted to describe the problem in a number of ways. There's a long-standing, persistent gendered recruitment of Filipino care workers to wealthier countries that takes advantage of the economic disparity. So this leads to our workers, their families, and their communities vulnerable to injustices, abuses, oppression, devaluation, burnout, trauma, as well as brain drain, care drain, and low self-worth to the people in the Philippines. And I would actually say the Filipino diaspora as well. Filipinos are now known for not staying in the Philippines, but for leaving the home country and growing and contributing to new countries, which I had a problem with when I went to the Philippines for my MPH and for other times I was there for my training. It just seemed wrong on a certain level that we're growing people to leave, right? So specifically in Canada and Manitoba, there's just some stats. In 2021, the Filipino women employment rate in Canada was among the highest for all visible minority groups, and significantly higher than non-visible minority Canadians. So this really just points to and supports the fact that there is this high recruitment of Filipino women. In Canada, almost a third of Filipino women are working in the healthcare and social assistance industry. One of the issues related to the pandemic was the fact that they're very much frontline workers. And the other piece of it too is that there's about 100,000 more working age Filipino women compared to men in Canada. So that's really this imbalance that we're seeing. Particularly in Manitoba, there's a high number of Philippine trained nurses in Manitoba who have not been able to get credentialed and into the system, at least working at the level that they've been trained. And then there's also been some recruitment fairs in the Philippines, and then when those workers come to Manitoba, they still have to write the NCLEX exam, which is quite expensive. So then oftentimes what they do is they downgrade so that they need to be able to afford the exam, and so they work as caregivers at a lower level just to be able to sit the exam. So herein lies an opportunity. We really do have a nursing crisis right now. There's high rates of burnout with the pandemic, and then of course a lot of nurses that are leaving the job, not just Filipinos, but overall. And then another piece of it too is that there's a new administration which is much more protective of worker rights and freedoms. So my vision really is to educate and empower Manitoba Filipino care workers to stand up against the abuses and devaluation, not just by giving them a voice, but by coaching them to step into their power more and to affect social change for themselves. The overall goal is to increase the self-worth of the Filipino people globally, and then as well, at some point, decrease and potentially reverse that brain and care drain that's occurring in the Philippines. So alternative strategies, if we did a traditional medical model here, it's a very long, complex process requiring a primary care physician referral. Most Manitobans don't have, or a lot of them don't have a physician, so there's often a wait list there. And we would need also specialized supports. So what I'm proposing is to use hypnotherapy to directly address and reverse internalized negative beliefs. So just to let you know, I'm also a hypnotherapist as well as a public health specialist and occupational medical specialist. Sorry. And just in terms of competition, there's no other programs that actually include both hypnotherapy as well as a comprehensive approach to burnout, looking at the mismatches that occur in the workplace related to that. So, yeah. So target population would be Filipina care workers, so that would include nurses and caregivers. And indirect beneficiaries could include their families, their patients, and the healthcare sector. And then success with a project could potentially influence policy and practice changes in other provinces and countries. So the project will offer a tailored boot camp for each group. Okay, so it's carefully designed, culturally sensitive, and it will incorporate hypnotherapy and coaching-based interventions, worker rights training, and be trauma-informed, anti-racism and healing aspects to it as well. I've already created the boot camp, so this would just be adding some pieces to it. And it's delivered through my app, which is the MedResRx app. And it's a blended approach of a different number of things. There's the app recordings, which makes it very convenient for people anytime, anywhere to be able to use, as long as they have a phone or computer. And then there's also some, potentially in-person sessions as well. And then there's a lot of flexibility that can be built into that project. And so, yeah, it would be about 2 years. A couple things, it's physician-led. I'm basically connecting with a number of different medical professionals to try to really inform that tailored boot camp that I'm going to be creating. And yeah, there'll be some regular feedback as well. One piece of it is also creating an advisory committee, which would be under the mentorship of Dr. Ray Pagdikan, who is part of the, he was a former MP as well as a physician. So there's a number of ways that we can do measurements. There's a burnout scale, that's a standardized one. There's another one that I had also created. There's in-app tracking, and then also there's some group stats that we can do. Sorry, don't have a lot of time here. So basically, theory of change is a lot of what I talked about earlier. These are just the pieces that are in the model there. So of course, there's some assumptions there related to hypnotherapy and how it's being used, and then whether that can actually affect the brain drain. And yeah, there's some also external factors as well that's not under my control, obviously. And so there's just a number of risks there: low enrollment, participation, potentially a stigma around mental health issues and reporting of abuses. So this is why we would also include informing and involving the employers, which is something that I'm involved with in my normal jobs. And then also the use of the app would be very much flexible, so that would really encourage and increase the access to the program. Basically, I'm going to just scroll through some of these pieces here. I will just get to the part here of how you guys can help. Basically, donations would be very helpful. Also, that can be either directly or through the FWN Giving Fund. Also, there's potential opportunities to invest. Basically, this is a baseline project, but it's also a passive income. So if there's aspects to the app that's already there and the work that I've done, if there's any kinds of aspects of the work that you're doing that might be able to use this kind of program, that's where you could potentially invest as well. And then other pieces of support there, advice, resources, referrals is another piece of it, and then other ideas for expansion. So yeah, basically next steps would be to contact me. I will have a summary handout, and I can email that to you that kind of has everything in it, because I know I've really run through this very quickly. And then also, if you're actually interested to learn more about hypnotherapy, there's a different ways you can do it. I can do individual sessions or group sessions. It's a life changer for me. I'm standing here because of hypnotherapy. So, there's my website there, so you can learn more about that. And then also, I also just launched a book, AI in Medicine, which was a 15-doctor collaboration. So, and then there's the link for the app there as well. And then just other ways to get a hold of me. So, Instagram, there's my social media, and then also the app is at the bottom as well. Okay.
Thank you, Denise.